from our perspective, we of course are responsible for helping states that host large numbers of refugees, because refugees, just like anybody else, will be exposed to this crisis. So our role is to make sure that states, especially states that have weaker health response systems, are equipped, are resourced, and are ready to include refugees hosted on their territory in the health responses that they are setting up. The main concern that WHO and we have is that states with less resources, with weaker health systems, are not yet equipped to respond in the same way as China has responded, for example, or countries in Europe and North America are responding today. And I think it is very important, this virus, as we have seen, knows no borders, no separations of categories of people. Anybody can be hit. So it's very important that we ensure that everybody is brought up to speed. This is a big challenge. Mm-hmm. It's a big challenge, but we need to do it. So we are all working in the UN to identify the most urgent priorities. From our side, we have identified the countries that host the largest numbers of refugees or displaced people and that have the weakest structure, and we're trying to focus on them by through sharing resources, ensuring that the personnel is trained, and having systems in place to at least face the hardest part of the crisis. There are also very complicated issues that are likely to emerge. For example, in refugee work, one of the most important issues is to tell countries to keep borders open so that refugees that are fleeing from war or persecution can find protection in asylum in other countries. Now, how do we reconcile that with the need to contain the epidemics and to actually prevent people from traveling? These are extremely difficult dilemmas that we're tackling right now, and we will need the help of the international community, especially in terms of resources, to support what we're trying to do.